Hello, good evening. How are you day? How are you? Welcome to another session of Ask the Doctors. My name is Dr. Frederick Unwigohai, and I be the host of this program. My co-host is Dr. Israel Irobonose. Now, on this program, we dey talk about health, we dey explain a lot of things. For today's program, we want to talk about upper respiratory tract infection. A lot of people no know about upper respiratory tract infection. So we won't break them down for you. Which you need to know. We go explain. If you dey watch this live session after we don't end, sorry, I no dey answer you because you come when we don't end. We dey start by 8 p.m. and we dey end by 9 p.m. So good evening. How are you? Tell me where you dey watch me from. Yes, we dey live on Facebook and we also dey live on YouTube. So I want me you tell me now. I get person they watch me for YouTube. I get people they also watch me for Facebook. So put in the comment section. Oh yeah, before I start this night, before we start to talk about upper respiratory tract infection, I want you to tell me where you they watch me from. Oh yeah, let us go. I want to read your comments. I want to read your comments. Oh yeah, put in now make I read your comment. I want you to tell me where are you watching me from? How are you? Compliment of the season though. Hmm? Oh yeah, gist me. Eh, Margaret. Margaret is watching me from Lagos. Margaret on Facebook, they watch me from Lagos. Oh yeah, you now put somebody else. Tell me in the comment section where you they watch me from. Let me give you shout out quick before we start. Uh-huh. Okay, yeah. Who else they watch me from Lagos? Yes, Isa Isa Omaru Ruma is on YouTube. Isa they watch me from Makurdi. Okay, Udwak. My people from the United States of America. Udwak, how are you? How is the United States? Who else they watch me? Let's see. Chiamaka Ugochukwu. Chiamaka is watching me from Port Harcourt. I just want to know, my people, where you dey. Whether you dey Nigeria, you dey Ghana, you dey South Africa, you dey UK, you dey United States, you dey France, you dey China, Australia, anywhere. Collins Benedion from Edo State, Nigeria. Collins is watching me on YouTube. Oh, shame. Now let's go to today's discussion. We are talking about upper respiratory tract infection, meaning say infection wey dey happen to people for the upper part of their respiratory tract. E confuse you? Oya, ma break am down. Let me explain. Your respiratory tract, this your nose. Through your nose, you go enter, you go pass through your throat area. You go down, enter your lungs. Now be your respiratory tract. So we get the one way dey for up, we get the one way dey for down. You dey follow me? So when infection happen for the upper part of your respiratory tract, we go talk say yes, so you don't get upper respiratory tract infection. Now the funny thing is say this infection dey happen to people well. This infection, man, see, I get many comments. People are commenting. Wait. Let me read your comment. Who dey here again? Mary, I see you. Wise man, wise mice Maureen, I see you. Maureen says, good evening, doctor. Thank you for always being here. I'm watching from Jos, Plateau State. Maureen, thank you for joining me. Thank you. Udwak, Ideo, code. Yes, I understand. Code too much for there. Kende, watching from Chicago. Okay, now. Life. Jospa is watching me from Abuja. Oshe, you're all welcome. Thank you for watching. So do me a favor, share this video. Let me see. Somebody says, first time of joining any live. Wow, nice one. You are doing a great job. This is your first time, Margaret. You are welcome. So, upper respiratory tract infection. Now, infection where they happen to people for the upper part of their respiratory tracts. They say a lot of people get this thing and then they'll come say, doctor, so wetin can they cause this type of infection? Very good, very good. This infection get plenty name, but everybody wey dey watch me, I feel bet say you don't get this infection before. And sometimes or most times, this infection they dey common towards this time of the year, towards the ending of the year, whether you dey Africa or even abroad. I will explain to you why. Because for those where they like Nigeria now, you go notice say the weather don dey dry, like harmattan don dey come. Abi, you understand? Very good. Harmattan don dey come. So when harmattan don dey come, you people go dey say, doctor, I dey get catarrh, I dey get sore throat, I dey sneeze. Those where they abroad, like Uduak now, wey dey for United States of America, he say the weather dey cold. Those wey dey for UK, the weather dey cold. So even during this period of cold, some of them they get catarrh, they get sneezing, they get sore throats. Now this period, so it dey affect the upper part of their respiratory tract. Yes, you dey follow me? You dey with me, Abi? Very good. Now, wetin dey cause am? Let me explain something. Number one, and people go tell you say, whenever the weather cold, oh, let me see let me see let me give shout out again to my people. Oni is watching from Dubai. Oshe, from Dubai. Who be this? This person is Mr. Alay, director, watching from Delta. Oshe. Dr. Israel is in the house. Esu Ewe is watching from Cameroon. You are plenty. I see you. I see you. Ijoma, I greet you. Dr. Israel is in the house, so I'm going to bring up Dr. Israel. Make we continue. But please remember, say upper respiratory tract infection. Now infection where they affect the upper part of your respiratory tract. Did you follow me? Good. Dr. Israel, good evening. How you day?
Good evening. I'm fine. How you dey? Sorry, I cannot join with light. No light for my side for today.
No, no problem, no problem. You're welcome. You're welcome. Thank you so much. Now, before you come, I've been to talk about within the upper respiratory tract infection, the parts where they affect. They affect from like the nose area, enter the throat, affect the sinuses. Your sinuses they here. It dey affect your larynx, like your voice box. It dey affect all these areas, and it dey common. Almost everybody where they watch me right now, if you don't get them. So I want more enter the next part. Who fit get upper respiratory tract infection? Dr. Israel, over to you. So just do a brief introduction and continue.
Okay. As Dr. Fred talk, upper respiratory tract na infection of the upper part of the respiratory system. The respiratory system they divide it into two. We have the upper respiratory system and the lower respiratory tract. So the upper respiratory tract contain your nose, your larynx and all that, the sinuses. When we say sinuses, holes, there are some holes where they are around the nose, when connect to the brain, connect to other part of the part, even your the one where even connects to your mouth and all that. Eh? So those are the upper parts of the respiratory tract. So any infection around this area now we dey call upper respiratory tract infection. So and everybody can be infected with upper respiratory tract, whether you be man, you be woman, you be boy, you be girl, small or old, you fit get upper respiratory tract infection. And also is dey very common in area when the weather dey very humid. When we say humid, um dey very dry. So na most people from that area fit quickly get upper respiratory tract infection. Place when dust full well, all those people, they are also very prone to get upper respiratory tract infection. Now this upper respiratory tract infection fit even lead to fit even continue become lower respiratory tract infection, that is come affect the lungs and the bronchi, all those other part of the respiratory tract infection and respiratory tract, sorry. But today we just dey concern
Mm.
about the upper part. And one of the reason why we really dey concern about the upper part is because For those of us within Nigeria, even outside the country, we will notice say weather don change. Some places they very hot,
Mm,
very windy and all that, and a lot of people they react to weather. So some many people they come down with this upper respiratory tract infection. When we
mm,
they call kata, kata, the normal name,
mm,
when people they sneeze and they bring out kata. So many people they come down with or another name we fit call am common cold. So when people they get all those things,
mm.
I will say, okay, it is good. May we talk about am today. Okay, Dr. Fred.
Yes, yes. Thank you so much, Dr. Israel. If you just they come, you dey welcome. We dey talk about upper respiratory tract infection. Dr. Israel don't break them down for you. Now let's go to the other area because he has mentioned it. So maybe we go there. But after we don't talk about the symptoms, Mo Kongo talk about waiting the cause am. And since Dr. Israel has mentioned some of the symptoms of this type of infection, may we list some of them, and then after we don't list some of these symptoms, we'll come enter. Okay, waiting they cause these things. Why be say people they get them? Why? Remember, weather don't change. But even as the weather change, some people no go still fall sick, while some others go fall sick. Sure, you dey follow me, Abi? So, waiting be the symptoms of upper respiratory tract infection. Very common one, very common. Person feel they cough. You go hear people they cough. It dey happen for this period. You go dey cough. Any small thing, the person come dey sneeze. Sneezing there among 18. Remember, dust don't dey for this period. Weather don't dey dry. So when you waka goes anywhere, small thing fit enter your nose, you start to dey sneeze. And then I go mention one more, and I go hand out over to Dr. Israel. May he continue. Now, as the person they cough, the person they sneeze. Sometimes the person fit also get sore throat. Sometimes if he gets sore throat, but the symptoms, now these few where I mentioned, then Dr. Israel go add some more and we continue. Dr. Israel, over to you.
Okay, yeah, as Dr. Fred already talked, those are most of the common symptoms. Then for those when they sneeze, you constantly notice say their nose go they run, the catarrh go they come up from their nose, and also they go they irritated. Any small thing they are not their body they do them one kind, they know they feel they know they feel themselves. May I use that word? They know they feel themselves because they irritated. Small things go irritate them and all that. Sometimes their body feel on they hot, or they get fever. Some of them go they get headache. And the reason why they get headache now because most of the time mucus don't block all those sinuses. Those sinuses not supposed they block, suppose they free. So when all those sinuses on the day block, sometimes they come they get headache. You come they be like say that they get
Mm,
malaria, not be malaria they get now just upper respiratory tract infection. Another thing you can notice say their throat they very dried, and their throat they
mm,
dried, and when their throat they dry, so you need say that they cough and many of all those things. Now good for us. Okay, maybe when Dr. Fred take us go the courses, I'll talk with him. I want to talk. So this one are just some of these
mm.
symptoms, the signs and symptoms when we go notice when the person they get all this when you get upper respiratory tract and infection.
Thank you so much, Dr. Israel. I like the fact that people now don't they understand what we they talk about. Remember, some people forget other sicknesses too. They forget cough, they forget other sicknesses too. But for this topic of today, this particular topic, the symptoms, cough, catarrh, sore throat, sneezing, sometimes headache, sometimes the person body feel hot, sometimes the person feel tired, sometimes if you get the throat feel dry. These are symptoms where you go notice where they happen for this kind period. Then why is it that this thing they happen this period? Weather, but waiting they cause am gone. Where we say when we don't get to this time of the year, people go come they notice say that they cough, that they sneeze. Because I can tell you for me, last week, every day for clinic, for where they work, every day for those who know where they work, I dey see at least two people every day. They come with this complaint. So I was not surprised and no fear. Some go tell you say, wait, why now? I say relax. Weather don't they change. So let's enter now. Waiting can they cause upper respiratory tract infection. But I won't beg you. I beg. Share this video because people need to learn. So share to your family, your neighbor, your church members. All your people share, make them come learn. Dr. Israel, over to you.
Okay, so when we talk, what did they cause this upper respiratory tract infection? I go just mention some. There are some things when I'll talk, you may not understand. But one, a virus, now they cause them. So that's the most commonest of all, virus. So and then because now virus, most of the time you not really need to take too many drug. Now some can be bacterial infection and all that, but the major cause of common cold, catarrh, upper respiratory tract infection, na virus. Then some can be allergic reaction. We say weather don change and all that. So sometimes your body can want to respond to these changes wey dey happen around. And the way of helping us to protect our tract, the breathing wey we dey breathe. Say as we dey breathe in dust and all those things. Now for the body to also help us protect our body, our lungs, make dem no get infected, make dirty no go enter our lungs, the body will start to dey produce a lot of mucus. And this mucus wey e dey produce na we dey call catarrh. So all those sneezing na just the body respond to make sure say all those dust wey don enter our body, all those things, our body don sneeze dem, don bring dem comot from our body, so that make we no get too many infection for inside the body. Also, another reason why this thing dey very rampant this period, as we talk, everywhere dey dry, the wind dey blow everywhere. So when one person sneeze, the wind go carry am. Because na viral infection, e dey quick spread among people. So once person sneeze, anybody wey dey around am, around 1 to 1 millimeter away from the person, or even 5 millimeter, the person fit even get am, if im own immune system not too dey strong. However, as I said, it can be allergic because of the weather. The body is trying to fight, wall off all the everything wey enter, the dust and the dirty, so it produce a lot of mucus. Two, virus na be the major cause of the
Mm.
upper respiratory tract infection. Bacteria can still cause it, and other microorganisms fit still cause am. Dr. Fred.
Yeah. Thank you very much, Dr. Israel. E get few things make I add. Now, some people dey, maybe the person no get virus, but e get some kind things wey you fit do, wey fit make you come down with this upper respiratory tract infection. Number one, somebody fit carry and give you. Dr. Israel mentioned am. Let's say person get am, the person come sneeze. As the person sneeze now, you dey around that environment, you fit carry am. Maybe e touch you, you put your hand, as e sneeze, you use am rub your eyes, you fit get am. Maybe the person can't sneeze, the sneezing can't touch the table, touch the chairs, or even your phone. You can't touch those things. You rub your eyes, you rub your mouth, you feel also get them. Or you dey where they very crowded. Now people they go out, they go market, where they go bus, where they enter buses and the rest. Even for children, now when picking they grow small, they can play where. So they mix up. So all these things will come make people feel they get them. Another one again, maybe your immune system, like Dr. Israel mentioned, your immune system don't go down. So when these things enter your body, your immune system will get enough power to help you protect you and fight all these things. You see how the thing they link together, Abi. And then for elderly people, these are some of the ways where people fit they get them. So now we don't mention how people they get them, waiting they cause them. We don't mention them. Then, is there anything we can do? Maybe when this thing come, make I ask Dr. Israel, maybe we go fit mention one or two tips for you, though we are not going to treat you here. We're not going to give you medicine. Do you understand? But one or two tips that can help you. Number one, cope this period. Number two, prevent this upper respiratory tract infection. Are we together? Before we mention the tip, everybody, I want you to share this live session. When you share, comment, I don't share. When you share, don't ask us any question that is not related to today's topic. We will not answer you. We no go answer you. Anything where you ask us, where they outside of today's topic, I'm sorry, my guy. We no go respond to you. So, oh yeah, everybody, share this live session right now. Share. I'm waiting for you. And when you share, I see your name. Say you don't share. You ask question. We can answer your question on the topic. Dr. Israel, over to you.
Okay, yeah. There are some things wey we fit do for to prevent or when somebody don already get this upper respiratory tract infection. Now, one thing you should know, we say na the major cause na viral infection, and sometimes it can be allergic, So because of those two things, most of the time you no need too many drug, you no need too many medication to say you want to stop am, because na virus, e go almost complete the course, and when e complete the course, e go comot. So the only thing wey we dey do is just to help treat the symptoms, all those symptoms wey e dey bring come. So if your body dey hot, take something to take calm the fever. If you get headache, take something to take reduce am. Then take a lot of fluid, water this period. When you take a lot of water, e go help not only when the person get the problem, also e go also help to prevent the e go also help to prevent upper respiratory tract infection. So when you take a lot of fluid,
Mm,
water, water or any fluid when you like, e go help to prevent upper respiratory tract infection. And also it's also one part of the thing wey you go fit take use take treat upper respiratory tract infection. Then if na allergy, you
mm,
take any allergic medication, e go also help to prevent am. But taking of water, a lot of water, then let me just mention this vitamin C. Those two go always help
mm,
you in preventing upper respiratory tract infection. As I said, if you get fever, you
mm,
take anything to calm the fever. If you get headache, take something to calm the headache. You know, one thing wey you need to know, if you get upper respiratory infection, you not get malaria. Many people dey confuse
mm,
those two things. Once they just see say they get catarrh, they cough, they'll say na malaria they get. It's two different things. You
mm,
can have upper respiratory tract infection and you not get malaria. So you no need to come dey
mhm,
go buy anti-malaria medication, or go dey buy, you say you don get malaria and typhoid, the common word when we for Nigeria people dey always talk malaria and typhoid. You come buy anti-malaria, antibiotics. All these things go lead to resistance to anti-malaria and antibiotics resistance. So you
mm,
really don't need them. What you just need na water, a lot of fluid, and also anything to help to reduce these symptoms. And also if your nose come block because of the catarrh, the nose come block, all those things, steaming can also help.
mm,
When you put your face this hot steam, you put small rub inside hot water and cover your face inside, so that you inhale it to open the sinuses. That one will help to open all the sinuses. And when you do that, that can also help to reduce the headache as well. And when you do that, it can also help to reduce the headache. So, and when you wan sneeze, abeg sneeze am. No hold am for body
mm.
say no, make I not sneeze. When sneeze come, sneeze it out. Because that will also help to free your airway and all that. Dr. Fred, why you dey laugh? So these are some of the things we can use when we talk about treating and also in a way preventing um upper respiratory tract infection. Also, if you see people wey dey sneeze, dey cough, you better give them face mask make dem wear. You can also put on face mask to this go help for barrier, make person no come sneeze for your body, or make you, if you have it, you wear face mask make you not sneeze for people body. And you cannot take away hand washing away from this
Mm,
period. Hand washing is
mm,
very, very important, because as people dey sneeze, people dey sneeze for anywhere, they can use their two hand to sneeze or sneeze for anywhere, and that same hand they go use am touch the rim wey you go touch, use am shake you, use am touch every part, different place, and you too can actually go and touch those things, and from there you don carry the virus and you can actually take it inside your body. So because of that, hand washing is also very important. You wash your hand with soap and water, or you use hand sanitizer. If you notice say your hand not too dirty, you can use hand sanitizer, and with that you would have saved yourself from coming down with upper respiratory tract infection. Dr. Fred.
Dr. Israel, thank you very much. Abeg, if you get question for this topic now, and you know say you don't share this live session, start dropping your question on this topic. We go take your questions. We go try by the grace of God answer you. So If you get question on this topic, no ask us any other question or we know they related to this topic. I beg, we no go read your question. And if you never share, click on the share button. Now, Dr. Israel mentioned a lot of things that can help you. Number one, take a lot of fluids, take water this period. Number two, ensure that you get vitamin C from your fruits or maybe the other one. Because if you notice, when you go hospital, doctor they give you this type of medicines. Number three, for those who get allergy, where they sneeze well, doctor will give you medicine for sneezing. Number four, you can't mention the steaming where you go boil hot water. That smoke where they come out from the hot water, you will cover your face, you go inhale them. These things what will they give you for here now to support you to help you. Now it gets some people where they get this upper respiratory tract infection. Some people e get their own bacteria fit cause their own doctor fit come give them antibiotics, but not that because somebody see say dem give am antibiotics, dem give im neighbor antibiotics or dey give antibiotics every time you get this type of infection you go dey drink antibiotics. No. Or because you get headache, you get catarrh, you go drink anti-malaria. No. E dey make sense, abi? And most importantly, your hygiene, your hand, as Dr. Israel talk it's very, very important. We dey advise you, no be because of COVID, because during that COVID period, everybody come dey shout, dey fear, abeg. Hand washing go help you well. Now, one other thing wey I wan add for everybody generally, e go good make you take care of your immune system because we don talk about immune system before, and we notice that for some people, when their immune system dey down, e fit make dem get this type of condition. People wey even dey very stressed, you go notice say when you no dey rest, you no dey sleep, your immune system can go down. Next thing, you don dey cough, you don dey sneeze, you don dey get catarrh, you don dey get sore throat. When you take care of your immune system, you are also supporting your body to protect you from coming down with upper respiratory tract infection. If you know say the things wey we don talk since from the beginning, you understand them, oya, put them in the comment section. And then if you get questions on this topic, oya, ask these questions now. They ask. Dr. Israel, you get anything where you want add again before the questions start pouring in?
Okay, yeah, Dr. Fred talk one thing when I think I just want to say one thing about now. Doctor fit give some persons antibiotics maybe because of wetin dem notice. Yes, this one na make e good when if you get any of this, you get upper respiratory tract infection, you get anything, you need to go to the hospital. Now there are some questions when the doctor go ask. Now with those questions, na doctor go really know what and what to give to you or what and what to tell you. Now, for people wey dey cough come bring say dem dey cough and the cough dey dry, nothing dey come out. Most of them, doctor no go give you antibiotics. But for those wey be say if dem cough, e dey bring out sputum, we call am sputum, and the sputum dey green or yellowish, all those kind thick sputum. So those are some of the kind of person when doctor go wan give medication, we wan see if you give medication. Or as you dey cough, you come dey get fever, dey join am. So you know say all those ones don dey lead, e not only just be upper respiratory tract infection again, e fit don dey go the lower part of the lungs. So e fit don dey enter the lungs, na make you dey cough like that, your body dey hot, maybe you no come dey fit breathe well and all those ones. You know say e don dey comot for upper respiratory tract. And those ones, doctor will likely give you medication to take help you, But apart from that, if na just normal cough, there's nothing like normal cough, but you just dey cough and e no dey productive, nothing dey come out, all those things dey dry. Those one most of the time, doctor will just give you some random thing to take reduce the cough. All those are allergy, and go tell you what and what to do. So,
Yeah,
Dr.
thank
Fred.
you, Dr. Israel. If you dey follow, yeah, thank you so much. You go notice say we don't mention some things wey fit help you this period. We don't mention some things where you fit do, especially if you get this upper respiratory tract infection. We don't give you free advice online. If you know say you understand wetin we talk, oh yeah, put in the comment section. Put, let's go. put. Um, okay, we have a question here. It says, if person gets upper respiratory tract infection, can you advise the person hot water? Can I don't really understand wetin Abdul Gafar they talk, but Dr. Israel, you fit try understand and more answer.
Can you, whether if they talk, can you advise the person to take hot water or not to take? You say now
Maybe
two word, to take or not to take.
not to take.
So I
Okay,
think
good.
Abdul, you need to let us know which of them is it, to take or not to take. Eh? But I know say most people will always want to ask, can you advise the person to take hot water or can you advise the person not to take cold water? So I know those are many kind of questions when person go ask. Yeah, most of the time it go good
Mm,
may you take water. Um, well, when it comes to taking of water, I dey very very skeptical to answer question concerning the kind of water you take because me know the kind of
mm.
water when me dey take whether I get
Yeah, yeah,
flu or
yeah.
not.
That's
I
true.
know the kind of water I take. So, but
But
it is
okay,
good that this person, but it is good that this person take warm water. It is good that this person take warm water. You remember we talk about steaming, because the heat go help. So when you take
yes,
warm water, that hotness of those water go still help to relieve those mucus environment and still make this person breathe well.
yeah. Thank you for that comment, Dr. Israel. Now, please, this question where Abdul Gafar ask us now concerning upper respiratory tract infection. When you get this condition, most times we know they advise you to take cold water because when you take cold water, it dey worsen the condition. All those your catarrh, your cough, cold water fit worsen am. When you get this upper respiratory tract infection, no, we are not saying cold water is bad because I understand now where this comment the waka go small small. I get catarrh, I get sore throat, I dey sneeze, and the rest. Can I take cold water? We will not advise you yes because we can't predict if you go take am, it could come make your own come worse, you can't get blocked. So we go advise you generally take warm water or ordinary water. Sure, you understand, Abi? And then if you want to go further, you can boil your hot water and do that steam. That steam will help you. Another one where somebody don't tell me before on one live session, he says, can I be drinking hot water when I have this condition? Hot water go give you more problem. If it burn your mouth, if it burn your throat and give you more problem. So we know they advise people to drink hot water because that hot water make you no go drink am, you can't give your body another wound wey no suppose to dey. So that is why you have to be careful and then speak with your doctor as well because e get some other things wey fit dey your body wey your doctor go need to pay attention as well. It makes sense. Dr. Israel, there's a question here. It says, can this upper respiratory tract infection, can it cause shortness of breath and anxious feelings?
Okay, for people wey get allergic reaction like asthma and all that, so this can actually be one of the precipitated factors, something wey fit make that shortness of breath come to be. That is this upper respiratory
Mm.
tract infection. So for those wey get allergic reaction, asthma and all that, yes, they can come down with shortness of breath and even this anxious feeling. And but if you no get allergic reaction, you no be an asthmatic patient, e fit block your nose, but e may not give you shortness of breath because you go open mouth, you dey breathe well and all those things. But e go make you fit get that small difficulty in breathing freely, from the nostrils. You fit get that feeling, but not just shorten your breath. But for those that are allergic, that have allergic reaction, that have asthma, yes, it can actually cause shortness of breath for them. So now make we dey always dey tell for all those kind of persons, you should know your trigger factors. You should know things that can
Mm.
trigger it. You should know that if you take this kind period, if you do this, you do this, it can lead to your asthmatic attack. So you need to prevent them so that make it not come, so that you can be free. Dr. Fred.
Yeah, thank you so much, Dr. Israel. One trigger factor for people who get asthma, upper respiratory tract infection. Now a known cause, a known trigger factor. So, what's your name? I believe say we don't answer your questions. Ujunwa, yes, we have answered you. If you dey watch us and you get questions for upper respiratory tract infection, ask now. In case you dey see us and you dey wonder who be these people, we are licensed medical doctors. Oh, no be say we just wake up and decide to start talking about the human body. We are licensed medical doctors and we take it upon ourselves to help our people, give them information we go help them. No be say these boys just wake up, they start to they call themselves doctors. Na lie. So we are here to give you information that will help you so that you no go dey confused. And then when you go hospital, you go know wetin your doctor dey explain for you, because a lot of people no dey even understand in pidgin English. Na im make us dey do am here. So we want you to share this video. We want you to invite your friends, make them come understand. Okay, so Ujunwa says yes. Okay, you understand. I see you. Benedicta, good evening. So ask us your question now on this topic. E get wetin Dr. Israel talk, and that is about malaria. Now, you can have upper respiratory tract infection and you no get malaria at all. So anytime you dey cough, you dey sneeze, and this, no dey go dey buy malaria medicine. In addition, you can still have upper respiratory tract infection and you fit still get malaria. So the two of them fit dey together. But not be say anytime when you dey cough, you get sore throat, you say, "Na so my body dey do me, na malaria I get." No, no, that is false. And that is why a lot of people they mismanage themselves. They can't they put problem for their body. The problem come too much. You dey follow me? Oh yeah. Oh. The funny thing, let's see. And now some people too don't come develop antibiotic resistance because anytime they get cough, they get sore throats, they get catarrh, they drink antibiotics. They drink them. And in the future, they can't develop antibiotic resistance. And then some people too who can't come hospital, who can't they shout for doctor, add antibiotics. Why you no give me antibiotics? Because anytime I dey get catarrh, I dey take antibiotics. It is very wrong. We have a comment here, Dr. Israel. He says, please, can this also cause severe cold and weakness in the body?
Okay, I would not want to say it can cause severe cold, but when you say weakness of the body, not really weakness, we call it malaise. You dey fatigue, you dey tired, and not like you will just dey very weak. You dey tired, you can dey irritated and all that. And sometimes some persons can have cold, but not severe cold. Remember the weather dey hot already, so if you are having severe cold and weakness, as you say, you need to know say not be only upper respiratory tract the person get again. Fit be say the person get other things accompany the upper respiratory tract infection. So in the case the person dey have that one and maybe come dey get difficulty in breathing and all that, you go know say e don comot for upper respiratory tract. This thing don dey go lower respiratory tract infection. So you need to go and seek you need to go to hospital, go see doctor so that make dem for fit know wetin dey really do am and treat the person accordingly and how e take present his signs and symptoms. Dr. Fred.
Yep, thank you, Dr. Israel. Let's see. I dey look for the questions now. No be say when we finish, you come dey ask us, doctor, answer me. No. Okay, Dr. Israel, he says, can it go away without treating it? Like people wey no get money to seek treatment.
Okay, if you remember the things when we first talk, if you remember all the things when we first talk in when we talk about treatment or management or preventing it, if you fit do all those things wey we mention, most of them you no need money to take do them. Steaming, you get gas for house, you get water for house, so you really don't need money to do that. Drinking of water, you get water for house, you still really no need money to take do that. Getting vitamin C, you get orange, you get pineapple, you get watermelon, all those ones go give you vitamin C, so you really don't need money to for those things. So for those wey no fit come go hospital, if you fit do all those simple simple things wey we mention, yes, you can get better. Mostly if na just the normal upper respiratory tract infection wey we say can be viral, it can be allergic reaction, you can get you get better without doing anything. So far you just dey take water, take vitamin C, you can steam yourself if your nose block. Within few days you will get you will get better. You will get better. But if you come notice say you don dey take all these things dey continue and this thing don dey make your body dey weak, you come dey get fever, you no even dey fit breathe, abeg try look for that money make you go hospital. But with those few things wey we
Hmm.
first mention, um yes, you can actually get better even though you no reach hospital.
Thank you, Dr. Israel. Udwak, I hope you understand. Abdul Gafar say, what is the difference between common cold and upper respiratory tract infection? Hey, ha.
Okay, actually, there's no difference. And I remember when I started, I tell you, say upper respiratory tract can also be known as common cold. So most of the time, when we say common cold, it's just people that is coming that comes down with runny nose and that have catarrh and all that. So, but upper respiratory tract is a general name. Hmm? That covers it, that covers all of them. Because common cold can be caused by something, and there are still other things that can cause upper respiratory tract infection. Um, when we talk about allergy and all that, but may not be really common cold. So it's just like upper respiratory tract is an umbrella covering common cold and every other things that can affect the upper respiratory um, tract.
Okay, oh, thank you. Now we are talking about this that we help our people for free. I noticed that some people never still share this live session. They never still share. Why? You have not shared though. If now where our people they do gossip, that place go full. But we are giving this thing to help our people. Oh. You say no. Okay. Let's see how it goes. I hope we don't try to explain to you what you can do. We mentioned that not everybody go need to go to hospital. With few tips where we don't mention for here, you can be fine. But you get some kind cases where we say the thing if you come pass from normal, enter serious problem. Those kind people go need to enter hospital. So you have to be careful, watch your body, and see how it goes. And if you don't try all the whole tips we give you here, they work. You will most definitely need to go and see your doctor. Do we have any questions again on this topic? Do we have any questions? Please drop the questions so that we go answer you now, because we go soon end very soon. Dr. Israel, you get anything to add? Because I believe we don't. Okay, one important thing where I think we'll talk about the place of hygiene. Huh? The place of hygiene. You please wash your hands when you dey cough. Not dey cough for public because Dr. Israel say make you no hold the cough. But when you want cough, no go open your mouth, cough for everywhere where people gather. Cough inside your elbow, or if you get tissue paper or handkerchief, cough inside because as you dey cough for there, you dey protect those other people wey dey around you so that you no go carry wetin dey your body give the rest people. Dr. Israel, over to you.
Okay, yeah. Wetin Dr. Fred talk now true. Even though we say, I know I said not just hold the cough, but I not say make you dey make you now make come become distributor. So you need to cough, and you need to follow the cough etiquette, and we call it cough etiquette. So you need to follow the normal cough etiquette. So if you want cough inside your elbow, eh? Because we know say e no dey easy for many people to go dey touch that part of the body. So you can cough inside the elbow. Another thing, if you get uh, um, nap handkerchief, disposable handkerchief or tissue paper, you cough on, you can sneeze on it, cough on it, and dispose it. After you do those ones, you need to go wash your hands. So I dey see one question where they say, can someone that have ulcer take vitamin C? I know say that because we dey talk about vitamin C. Now you should know that there are different fruits that give vitamin C. There are different fruits that give vitamin C, and not be everybody wey get ulcer, vitamin C dey cause problem to them. So if you get ulcer and vitamin C dey cause you problem, you go leave vitamin C. But if you get vitamin C not give you problem, e no dey exacerbate your ulcer pain, you take vitamin C, because not be everybody can vitamin C go dey exacerbate their ulcer pain. So let's go back to the hygiene when we dey talk. Now, before we talk that again, remember we don already tell you say upper respiratory tract infection, you can take care of it at home. So within 7 to 10 days, um within 7 to 10 days, upper respiratory tract can is self-limited. It can stop within 7 to 10 days. So if e don dey pass 10 days and you still dey get am, you need to seek you need to seek um you need to seek help. Then we don talk say if you wan cough inside elbow, wash your hands, very important. Keep your environment clean. Then try to make sure say your environment not too dey dusty. So you also need to run away from dust. The use of face mask is very, very important. And also, when you use your face mask, it's also very good that you dispose your face mask very well, so that you no go come dispose am for where people go see am, use am take play. It is also good for us to know, so once you use one face mask, you are supposed to dispose that face mask. Not be say you use am, you can't keep am, say you wan reuse am the next
Mm,
day. Because that one
mm.
you dey give yourself wetin you don first throway. You dey give yourself wetin you don first throway. So once you use one face mask, you discard it, wash your hands. And you see, I dey talk this wash your hand like 1,000,001 times. That's to tell you how important hand washing is in terms of upper respiratory tract and in terms of many infection. Hand washing is very, very important. And we don already talk say make sure say your environment not too dey dusty. We don already talk say make you try to dispose anything when you use, like your handkerchief, your tissue paper, and your face mask. Dispose them for the right place where you suppose dispose them put. Not throway them for anywhere, not just throway them for ground or put them anywhere. No, dispose them for the right place. I will already talk about cough etiquette when you cough inside your elbow, and all that, or even sneezing inside your elbow. So I think that's all I want to say on that.
Yeah, thank you so much, Dr. Israel, for these wonderful responses you have given. And I believe that those way they watch us, you way they watch me right now, you don't get few tips to help you for upper respiratory tract infection. Few things where you feel do, we go support your body this period, help your immune system. You rest, you eat balanced diet, take fruits, take water. It will help you very much. Now, somebody they ask us one question, and this question I don't know how we want to link this question to this discussion today. It says, and what's the difference between upper respiratory tract infection, lung syndrome? Mr. Victor, your question no dey clear at all. Upper respiratory tract infection and lung syndrome. I don't understand. I don't know if Dr. Israel gets your point. I don't know.
Now, you not really need to talk so much on this reason, because see the word lung syndrome. Lung syndrome don already become lower respiratory tract organ. The lungs is is a part of the lower respiratory tract organ. So when we say upper respiratory tract, we talk about the upper part of the respiratory system, which contain your nose, your larynx, your sinuses, eh, larynx, pharynx, yes, and your sinuses. Those are the upper respiratory tract, all those sides. So once you don't pass there, don't they go your bronchial, your bronchus, your lungs? That is already the upper respiratory tract, or lower respiratory, lower part of the respiratory
Respiratory tract.
system. So
Yes, yes.
yes, lower part of the respiratory system. So when you talk about lung syndrome, it's no longer, the difference is already clear. The one and the lower lungs, lower respiratory tract, while upper is the upper respiratory tract. And you should know that upper respiratory tract is is an infection that is self-limited. Now, when you see the word
Mm,
syndrome, it means a lot of things they happen there, which you may not be able to treat, you may not be able to, there may be no cure to it, but
mm.
you can just be managing them.
Thank you for that breakdown. Okay. So, Mr. Victor, I believe you understand what Dr. Israel talk, right? Who be this? Brianna Adebola. Okay. Now, if you just dey come, you dey welcome. This program now every Sunday by 8 p.m. West African time to 9 p.m. 1 hour. So if you come late, you just dey come right now. You don't miss a lot. I go advise you, may you try go watch from the very beginning. Wetin we dey talk about. Every Sunday we dey come here like this. We dey talk about one topic. Sometimes we dey make an open day and we dey take your questions randomly. But today we are talking about the upper respiratory tract, and the infection wey dey happen for upper respiratory tract. So now the name be that. So I go advise you, may you try to watch this video again. Try not to come late, because if you come late, you go miss. And most importantly, share this video. I don't know why our people are stingy to help them people. I don't know why our people are stingy to help our own people to share this information to them. Help them, oh. Things hard though. Protect yourself, and we're trying to play our own parts to help. So I don't know why you are stingy and you're not sharing. Okay, God day. Let's see. We are almost rounding up the topic tonight. So you get some questions we know they related to this topic. And no vex. We no go answer you. I'm sorry. No vex. Okay. Dr. Israel, I don't get any other thing to talk again. So let's just do a brief recap as we round up tonight. So we told you that the upper respiratory tract, it gets upper and lower parts. Upper one from your nose, your sinuses, your larynx, your pharynx. So when you get infection around that area, we dey call them upper respiratory tract infection. We get the lower respiratory tract, and the lower respiratory tract fit still get their own infection. We also told you that this upper respiratory tract infection, it dey common when we don't dey enter certain time of the year, certain season, like where we dey now, the weather don't dey dried. For some other people, it dey cold. So you go notice say they fit dey cough more this period, fit dey sneeze, fit dey get catarrh, fit dey get sore throat, fit dey get headache, dey get small small body pain. They don't understand how the body dey do them. These things they happen, and I talk am say I don't see some patients last week, almost two patients every day wey dey get this symptom. E no mean say make you dey panic. We can't tell you say no be the same thing like malaria, because some people go talk say whenever my head dey disturb me, I get catarrh, I get sore throat, I don't get malaria. No be malaria be that. Now wetin we dey call upper respiratory tract infection, and na virus dey cause am pass. This virus, even without taking any medicine, if it disappear on its own, it go. Just that you might need to support your body small, we go help you. How? You go need to rest, you go need to take more fluids, you drink more water, take warm water, not take cold water this period where you get this condition, because your cold water feel worsen your cough, if it make you they sneeze more, if it block your nose and the rest. So take more warm water. Take fruits we get vitamin C, or take vitamin C this period. We also told you that You go need to boil hot water and steam, cover your face, inhale am. E go help you clear your sinuses, clear your nose and this period. We also tell you say try to take care of your immune system, because we notice say people when their immune system go down sometimes they dey get this symptom. We also tell you say e get how you go where dey very crowded, people plenty, and people full that area. Somebody fit just come for there now, just sneeze, e dash everybody for there. Or you go use your hand touch wall wey the person don sneeze put, you use am scratch your eye, you use am put for your nose, you fit carry am. We mention all these things, and then we can't talk say e get medicine wey dem fit give you for hospital wey fit help you fight this allergy. Somebody come ask us, but what if I get this thing, e fit make me no fit breathe well? The answer na for people wey get allergy. E get how they go get this upper respiratory tract infection, e fit come dey worsen their breathing problems. So everybody here, wetin we want make you know be say try to protect yourself, try to wash your hands, because hand hygiene dey very important. Try to take care of your immune system, try to take fruits, try to support your body with vitamin C and the other things wey go help you rest. And then we can't tell you say please if you know say you don dey try to dey help your body, this thing still continue, e can't even dey go further, dey worse, enter hospital no go sit down for house. I don't know if Dr. Israel get anything to add for here.
No, you don't. I think you don't. Now, summary. So you have given all the wonderful part when they really need to know for the summary.
Yes. So make we round up because you don dey near 9 p.m. and now 1 hour be this program. 1 hour. Dr. Israel, make we round up, eh?
Okay, and we don't do our part. We've talked, and we believe say you listen and you understand all wetin we talk. So it go good make we, as you don't listen, you don't understand. Not be only to listen and understand. Now make you also practice most of these things when we talk today. And as you dey practice and you also for you to see teach other people where they are around you so that make them for still know. And with knowing all these things, it will help to reduce upper respiratory tract infection. And it's also good for us to know say children this period now that they quick come down with upper respiratory tract infection. In fact, many children this period go actually get this infection. So we also need to protect our children against this upper respiratory tract infection, giving them water, making sure that they get everything when they need to take keep themselves from this weather when we dey. And I beg, try dey drink a lot of fluid, try to take care of your mental health. I know say Christmas don dey reach, people don dey run up and down to see say yes, they fit get one or two things to take celebrate this Christmas and the New Year. But remember say these days are just like every other normal days. You dey eat rice before, you go still eat rice that day. So it's just like every normal day. So no go overdo anything so that make you not come down with one illness or the other wey you go come still dey run dey go hospital go dey take care of. And also remember for those wey get children, remember say January dey grand when you go start to dey pay school fees again. So remember all this as you plan for Christmas and New Year celebration. Before I go, I want to say Merry Christmas and Happy New Year to all of you.
Thank you, Dr. Israel, for this wonderful end notes. We want to say thank you again. No break your account, no let anybody put you on pressure. If you no see chicken buy, eat fish, life continues. If you no see frozen thing buy, eat the one with your power reach. Don't let anybody pressurize you. Protect yourself. You get how the country be right now. Everywhere tight. But our job here now to do the little way we feel do to help you. I beg. If you notice that you get any problem for your body, one thing they do you. We always beg you. Follow your doctor talk, make them help you. No go sit down for internet, they find medicine because you get kind of medicine where you go take on the internet, you go worsen your problem. And by the time you go enter hospital, matter don't tie wrapper. So I beg you, open your ear, dey careful how you dey follow collect treatment on the internet. Our little parts now we dey do here to help you. E clear, abi e no clear. I go always tell you, good life now waiting. Good life. Oh yeah, everybody comment am. Good life now waiting.
Good life now sense.
Yeah, so good life, na sense. Thank you, everyone. Thank you for watching. Thank you for sharing. We will see you next week Sunday. Take care and have a wonderful day. Bye bye. Bye bye. Bye bye. Bye bye. Yes, thank you so much. Ivie Gloria, I see you. Thank you. Thank you. Thank you.